Good morning, everyone, and welcome back to our channel. Today, we re-diving into a topic that affects millions of people across the USA and around the world. Back pain. If you've ever woken up feeling stiff, sore, or with that familiar ache in your lower back, you know how much it can impact your entire day. The way you start your morning can either set you up for a day of comfort and mobility or a day of nagging pain. Many of our daily habits, especially those we perform just after waking, can unknowingly put a strain on our spine. But the good news is, with a few simple adjustments, you can turn your morning routine into a powerful tool for protecting your spine and preventing pain. We are going to explore 6 essential morning habits that can help you protect your spine and significantly reduce back pain. These are practical, easy-to-implement changes that can make a world of difference in your long-term spinal health. So, grab your coffee, get comfortable, and let's get started on building a better, pain-free morning. The first habit, and perhaps one of the most crucial, is to change the way you get out of bed. Many of us, still half asleep, tend to sit straight up, almost like a sit-up, or we twist our torso to swing our legs over the side. Both of these movements place a significant and sudden load on the spinal discs, which are particularly vulnerable in the morning. After a night of lying down, your intervertebral discs are what's called superhydrated. They've absorbed fluid and are at their fullest, which actually makes them more susceptible to injury from compressive or twisting forces. Think of them like water balloons that are filled to capacity. A sudden squeeze or twist is more likely to cause damage. The proper way to get out of bed is a technique often called the log roll. While lying on your back, bend your knees. Then, keeping your shoulders and hips aligned as a single unit, roll onto your side. Use your top arm to push yourself up into a sitting position as you simultaneously swing your legs over the edge of the bed. This method keeps your spine in a neutral, straight alignment, avoiding any stressful twisting or flexion. It might feel a bit slow or methodical at first, but making the log roll a non-negotiable part of your morning routine is a fundamental step in protecting your spine from the very first moment of your day. It is a small change that pays huge dividends in preventing acute flare-ups and long-term wear and tear. Once you are safely out of bed, the second habit to adopt is immediate, gentle movement and stretching. Avoid jumping straight into high-intensity activities or even just bending over abruptly to put on your socks. Your body has been relatively still for several hours, and your muscles and joints, particularly those around your spine, need a gentle transition from rest to activity. A few minutes dedicated to simple mobility exercises can wake up your supportive core muscles and increase blood flow to your back, reducing stiffness. Start with some very basic movements. For example, while standing, you can perform pelvic tilts. Gently tuck your tailbone under and then release, repeating this motion 10 to 15 times. This helps to activate the deep abdominal muscles that stabilize the lower back. Another excellent exercise is the cat-cow stretch, performed on your hands and knees. Slowly arch your back up towards the ceiling, like a cat, and then gently let your belly drop towards the floor, creating a curve in the opposite direction. This fluid movement mobilizes the entire length of your spine. You could also try Gentileschi stretches, either one leg at a time or both together, while lying on your back. The key here is to be gentle. These aren't meant to be intense, deep stretches, but rather a way to gently awaken the tissues and prepare them for the day. Think of it as a warm-up for your spine before it has to handle the demands of gravity and movement. The third habit is all about hydration, but specifically, hydrating before you have your coffee. We all know that drinking water is important for overall health, but its role in spinal health is often underestimated. As mentioned earlier, your spinal discs are hydrated overnight. Throughout the day, as you stand, sit, and move, gravity and body weight compress these discs, squeezing out some of that fluid. Rehydrating first thing in the morning is essential too. Replenish this fluid and maintain the disc's height and cushioning ability. When discs are well hydrated, they provide better shock absorption and allow for more flexible movement between the vertebrae. Dehydration, on the other hand, can cause these discs to shrink and become less effective, increasing the risk of friction between vertebrae and potentially leading to pain and degeneration over time. While coffee does contain water, it is also a diuretic, which means it can cause you to lose more fluid. By drinking a large glass of plain water before you even think about brewing your morning cup, you give your body, and specifically your spinal discs, the pure hydration they need to function optimally. This simple act helps maintain the integrity of your spinal structure and can significantly reduce the stiffness and achiness associated with mild dehydration. Our fourth habit focuses on mindful movement during your morning bathroom routine. The bathroom is a place where we often perform actions that can be surprisingly hard on the back, usually without even thinking about it. Bending over the sink to brush your teeth or wash your face is a prime example. Most people will bend from the waist, rounding their lower back and holding this flexed position for a couple of minutes. This places a sustained, stressful load on the lumbar spine and its discs. To protect your back, practice a hip hinge instead. To do this, stand with your feet shoulder-width apart, slightly bend your knees, and hinge forward from your hips, keeping your back straight and your core engaged. You can place one hand on the countertop for support. This technique utilizes the strong muscles of your hips and legs to support your upper body, taking the pressure off your vulnerable lower back. Similarly, be mindful when getting on and off the toilet. Instead of just plopping down or using your back to stand up, treat it like a squat. Keep your chest up and your back straight, using your leg muscles to control the movement. These may seem like trivial adjustments, but when you perform these actions every single day, the cumulative effect of doing them correctly can save your spine from thousands of repetitive micro-injuries over the years. The fifth habit involves rethinking your sitting posture, especially during breakfast or your morning commute. After gently mobilizing your spine, the last thing you want to do is slump into a chair and undo all your good work. Prolonged sitting, particularly in a slouched position, is one of the biggest contributors to back pain in the modern world. When you slouch, your pelvis tilts backward, flattening the natural curve in your lower back, the lumbar lordosis. This posture increases the pressure on your spinal discs and can overstretch the ligaments and muscles that are supposed to support your spine. Whether you're sitting at the breakfast table or in your car, make a conscious effort to sit actively. Sit all the way back in your chair so that your back is supported. Try placing a small rolled-up towel or a lumbar roll in the curve of your lower back to help maintain its natural arch. Keep your feet flat on the floor and your knees at roughly a 90-degree angle. Engage your core muscles lightly, as if you're gently bracing for a poke in the stomach. This doesn't mean you have to sit rigidly like a statue, but by maintaining this supported and aligned posture, you are actively training your muscles to support your spine correctly, reducing strain and preventing the development of postural pain that can plague you for the rest of a day. Finally, the sixth habit is to avoid lifting heavy objects immediately after waking up. This is a critical rule for spine safety. As we've discussed, your spine is in its most vulnerable state in the first hour or so after you rise. The discs are full of fluid, and the supporting muscles are not yet fully awake and ready to engage properly. Lifting something heavy during this window weather, it's a child, a bag of groceries, or a laundry basket dramatically increases your risk of a disc-related injury, like a herniation or a bulge. It's best to postpone any heavy lifting for at least an hour after getting out of bed. If you absolutely must lift something, it is imperative that you use proper lifting mechanics. Stand close to the object. Get a wide stance. Bend at your knees and hips, not your waist. Keep your back straight, engage your core, and lift with your powerful leg muscles. Never twist your body while lifting. Carry the object close to your body to minimize the leva arm and reduce the strain on your back. By being patient and allowing your body to fully wake up and your spinal discs to lose some of their morning hydration and become more resilient, you can avoid a sudden, debilitating injury that could have been easily prevented. In conclusion, integrating these 6 habits into your morning routine can fundamentally change your relationship with back pain. By focusing on how you get out of bed, incorporating gentle movement, hydrating properly, practicing mindful posture in the bathroom and at the breakfast table, and avoiding early morning heavy lifting, you are creating a protective shield for your spine. These changes are not about adding a strenuous workout to your already busy morning. They are about being more mindful and making smarter choices in the movements you already perform every day. It's about building a foundation of spinal health that will support you not just through the day, but for years to come. Remember, consistency is key. Transforming these actions into automatic habits will provide the greatest long-term benefit. Thank you so much for joining us today. We hope these tips empower you to take control of your spinal health and start every day feeling stronger, more flexible, and pain-free. If you found this information helpful, please like, share, and subscribe for more content on health and wellness. We'll see you in the next video.